Thank you, Presiding Officer. I'd like to remind the Chamber that I am the Vice Chair of Moving On Inverclyde, the local addiction service. Can the Minister indicate whether the families of people living with drug and alcohol misuse have been involved in the design of recovery services and treatments, including the implementation of the MAT standards?
Minister.
As part of the national mission, the Scottish Government provides local areas with £3 million per year to ensure that those with lived and living experience, as well as their families, are involved in the design and the delivery of local treatment and recovery services. We also provide £3.5 million per year through our Whole Family Approach Fund to enable local services to provide support to families impacted by drugs and alcohol. And we need to remember that the MAT standards were also developed by the Drugs Death Task Force, which benefited from the views of those with lived and living experience, which included family members and experience. The MAT standards are not only of the Scottish Government's making, but they are actually led by those who are at the front lines on it. Those voices were also reflected in the Public Health Scotland's benchmarking report on MAT standards, specifically including forewords from people with family experience. And I've also recently met with family organisations after their Empowering Families on the Frontline conference back in March. And these are families who are feeling empowered to help drive change on behalf of their loved one and indeed on behalf of themselves. And we must listen to them.